Good evening, ladies and gentlemen who have joined us on this Dr. Fundi channel, joining us via multiple social media platforms, YouTube, Twitter, Instagram, and also via the Dr. Fundi website. Welcome. Today, I've got a special guest, somebody who is not a stranger to this channel. Today, I am hosting Dr. Maggie Mojapelo. She is my senior from medical school. She is somebody that has been doing great things in our space of healthcare and beyond. She was one of my guests during the August month that was dedicated to women. She's back here today to talk about something that she touched on the day, but we didn't go deeper because the focus for that day was to celebrate her and what she has done in our space in healthcare. So today, she is here to talk to us about an initiative that she is having, an initiative that she started a few months ago, an initiative that is about a virtual memorial for all the healthcare workers that have unfortunately passed away, largely due to COVID, but also other related illnesses, or other illnesses during this period of the pandemic. So, but I will not go deeper. It is for her to share with us what all of this is. But in addition to the fact that she has this memorial that she has started, there is a walk the talk by 702 this coming Sunday. And she has linked the 702 walk the talk with her initiative around the health workers memorial. So Dr. Maggie, please welcome to the Dr. Fundi channel.
Thank you, Fundi, and all the listeners.
There is some echo. I hope it's not because there's also a smartphone that is also connected. Maybe if you can switch off that smartphone, we won't have the issue.
Okay.
Right. Can you hear me now, Dr. Maggie?
Yes, I can hear you, Fundi.
Yeah, your voice is a bit low today. That's unlike you. You normally have a very powerful voice.
Okay. Okay. Yes, Fundi, I'm here.
You are here. All right.
Yes.
All right. I've just told the viewers that you are here today to be able to help us understand the virtual memorial that you founded a few months ago. But not only that, but also the fact that you have now linked it with 702 FM Walk the Talk, which will be a virtual walk. So can you just tell us a little bit about the idea of the memorial first, and then we will talk about what's happening on Sunday.
Okay, the digital memorial was born out of the anguish and the pain that healthcare workers were experiencing all over the country, especially since COVID started. We have been monitoring the number of deaths associated with healthcare workers. And in this instance, I have to emphasize that when we said healthcare workers in this instance, we meant all the team around care provision, care coordination, starting from the cleaner, the porter, the paramedic, nurses, doctors, and professors. So it was envisioned that all should be included in this memorial as a historical record of the events that are happening or in our time for, indeed, for historical records.
Yes. All right. So, but what, obviously you had this idea, but what actually made you to say, you know what, it can't just be an idea. Let me actually make sure that it becomes a reality.
All of the healthcare workers now, everybody will remember that in most of our social media platforms, we had all these sad news that are emerging so much that the doctors were contracting or the healthcare workers were contracting COVID. And not only that, we had casualties as well.
Yes.
So in all social media platforms, in all doctor groupings, from SAMA, National Health Professional Association, all the WhatsApp groups from, our groups from RES.
Yes.
What was a common denominator? It was this, it is with sad, news that we announced the death of. And that was followed by a lot of emojis, these emojis where there's that emoji where you shed a lot of tears.
Yeah.
And it was all over the social media platform. And obviously, when one looked around, realized that it cannot continue as business as usual, because we've got an avalanche or apocalypse that seems to be facing healthcare workers, obviously the citizens of the country, but in our case, the healthcare workers were, passing on in quick succession rates, and that had to be interrogated. And with my passion for memorials, because I've done one before, the
Yes,
Togoza
I'm still going to ask you about that one.
Okay, so it suddenly ignited the passion that we must document the events of what was happening. I started the initiative collecting names from December. December, it was not much, it was more overseas. And then cometh March, then we started seeing casualties increasing in South Africa.
Yes.
Then 2 is better than 1.
Yes.
One decided that you cannot do it alone.
Yes.
Collectively, with the Medical Women Association called MWASA.
MWASA, yes.
Yes, we joined forces, and because it's provincial and it's in all the provinces, I moved quickly to appoint ambassadors. We have got ambassadors, Western Cape, Northwest, etc., because it was easy because they were closer to the situation there.
Yes.
And fortunately, it attracted one of the media houses, yes, and the Daily Maverick. Yes. And they were very keen on the project because they were following on closely with what is happening to the healthcare workers. Yes. And indeed, we were planning to celebrate women, inspirational women in health. That was our original objective with the BHF. And it suddenly clicked that the casualties were so much that we could not just celebrate inspirational women in health. Yes. We have to include the memorial project in one way or the other. And indeed, it was unveiled on the platform of BHF. They had an event and they included us. And it attracted also the World Health Organization Africa office, because in our vision, we said that it should include not only South Africa, but Africa as a continent. That is how World Health Organization was attracted to the project, and indeed it was unveiled by the regional director, Dr. Moeti.
Beautiful, beautiful. So, Doc, now I heard you mentioning that you had started already in December. Now, that was before COVID came to South Africa. So, what I'm reading then is that these memorials are not only for people who died of COVID, but it's basically a memorial for all people who are in the healthcare space, healthcare workers.
Yeah, indeed. You see, Fundi, the memorial is trying to highlight quite a number of important factors.
Yes.
One of the factors that is important is the safety of healthcare workers. The occupational health risk faced, the occupational risk that the healthcare workers face in our daily, lives.
Yes.
So I'm talking about TB,
Yes.
MDR, mental health, suicidality, anxiety, depression, burnout. I mean, I was listening to your show about the mental health of healthcare workers, which is becoming a big thing now. All of us are burned out and, depressed, anxious. And then the infectious diseases like MDR,
Yes.
they have killed quite a number of our healthcare workers.
Yes.
But it has never been a big issue because you find one there, 2, 3 there. Now, COVID became a catalyst to highlight the infectious, the occupational health risk that the healthcare workers face. And with COVID, it was not 1 there, 2 there, 3 there. It was taking a lot of us in quick succession, as of March.
Yes.
So it highlights that. So it is not a COVID memorial.
Yes.
Ironically, it's because it so happened that almost, I think 95% of the people who are on that memorial, most of the stats are COVID related, but it's not just COVID as well.
Beautiful. So, Doc, as we speak today, what numbers are we talking about of the people who have already been recorded in the virtual memorial?
I think the numbers are standing at about 250 or 60. We are now in the clip that I have shown you that I think if we have time, we can sort of play it.
Yeah.
We've got about 250 or so.
Yes.
And we know that we are trying to match it with the stats of the Department of Health.
Yes.
And we know that the Department of Health is locating about 237 or so. But obviously, we know that the numbers might be less. And Fundi, it cannot be business as usual when you've got 250 healthcare workers dying at the same time. It cannot be business as usual. On the memorial, we have got about 13 professors. Never in our history, as long as I remember, that we had 13 professors passing on at the same, within a short period of time.
Short space of time, yes. Yes, I mean, amongst those, obviously there's many. I mean, Professor Pepeta is amongst those people, and then many other, top professionals. But like you said, it's not just about the professors, it's for everyone who is in the healthcare space.
I have to mention with the professors why we included them.
Yes.
We included the professors by virtue of the number, yes, but one of the most important aspects of the professors, we are honoring them as icons who have contributed so much to our health ecosystem, research, academia, teaching of us. Some of them on the list have taught us, and their contribution to, humanity and health sciences, it's enormous. And I just feel that that part of history, it cannot be archived. So much that with this memorial, one of the objectives is to put the history, to capture the history of each one of the professors, because it's enormous. And then hopefully it will form part of the syllabuses, and we will liaise with the medical schools and other associated facilities to make sure that this history that is so rich of our professors and even our healthcare workers. There are doctors who have served the community. The doctor from Bloemfontein, has served the community. Farid Bax has served the community. My iPhone is interfering. Has served the community for 36 years. Can you remember the iPhone, please? It's on the has served the community for 36 years. And that is, there's a rich history there. Each one of the name on the memorial, the sisters who have served us, you know, with diligence.
Yes.
40 years of service, some of the sisters.
Yes.
And then they are captured on the memorial.
All right, Dr. Max, I've muted Fina's iPhone because it's creating some some noise.
Yes, please. Yes,
so I've
please.
muted that. Yeah.
Yeah. So Fundi, we are talking about the history, the historical record that should go in the syllabuses of the our medical schools. That should be, you know, a giant leap for many of the students that will see hope and will get motivation and indeed, you know, climb on the shoulders of these giants, even if they are not with us, but the legacy should live on.
I think it's very, very important, Max, because like you had said, you know, some of these professors, you know, they have actually contributed so much. And I think people will not appreciate the fact that, and here now I'm going to focus a lot on the Black, professors. Many people will not appreciate the fact that just about over 50 years ago, let me say around 1948, 1949, there was no medical school that was dedicated to actually training Blacks, and Blacks here I mean Africans, Indians, and colored. And the first medical school to do that was in 1951, which is, University of Natal Medical School. Before then, you would have one person there at Wits, and another one there, or those who would go and get trained overseas. So most of these, professors, are people who have been produced in the last, few decades, and they still had so much to contribute to taking this, medical, profession in various ways, take it forward. So now, Doc, with this memorial, how does a family or friends get to inform, yourself or whoever that you are working with that there is so and so who has passed on, and we would like this person to be included in the memorial? How does it happen?
Yeah, so how we collect names, that is, we're talking about data now.
Yes.
Immediately after we went live on, with the Daily Maverick, there was a number, and because it's closer to my heart, it was my cell number, WhatsApp, and it was supposed to be the point of contact. And the info@healthcare workers memorial, that is the email. But Fundi, I think 100% of people use WhatsApp. Yeah. Let me tell you that this is a memorial whose database was collected through WhatsApp, whose database from the families. The families submitted some of the most heartbreaking yet heartwarming messages. Please put my mom. My mom passed away after my granny passed away with COVID. Please put my mom on the memorial so that I can print this memorial and put it there for grandchildren to see.
Yes. Yes.
Some of the families, it was not only families. We've got Sister Christina from Parklands in Springs.
Yes.
Lost a friend, and some other people like Dr. Jose Chiebwe, that was an anesthetist
Yes.
who used to work with them. He was a scrap sister. And ironically, she's the one who's working for the two.
Yes.
And he said, please put these two. I would like them to be on this memorial, and this is the reason. There are different reasons.
Yes.
To
yes.
print for the grandchildren one day to see.
Yes.
Some people were saying to realize that they didn't die in vain. At least they have joined some of the soldiers who went to the front line. So I'm saying, I usually say, I have sent you a montage that I think at some stage we'll see. It is closer to my heart. If you look at that montage, it has encapsulated each and every one of the people who are on that memorial.
Yes.
They are saying that, some of those symbolic plaques or memorial, or they will print them and they will enlarge them and put them in their houses. And then the other source of collection, the doctor groups. If you know very well, it is with Sad News to announce SAMA, which is also our partner in the memorial. They also contributed a lot because quite a number of members were SAMA. Medical Women Association, we lost quite a number of women doctors. And of mind that comes, that is very painful. There's a young doctor in Mpumalanga, Dr. Masha, who lost 2 young kids. We're still going to talk, I hope we still have time to talk about what the memorial tend to achieve, especially in terms of those young children who are left with granny, who are being supported by granny. We're talking about the sisters at the moment who are also in that situation. So we collect, in summary, we collected them from WhatsApp. The people were sending messages through there. A lot of the family members, info at Healthcare Workers Memorial, the different hospital groups, Netcare, Mediclinic, and Life. It didn't spare any hospital. It didn't spare any public hospital, public clinic. We've got people from Kayelicha Clinic. They have lost their members there. They send the messages that we must put them on their memorial. And also what was important is that they also sent the Zoom meetings of the funerals. They also send the obituaries to the platform, so much that at the moment is also the memorial is serving as a platform, not only for support, for healing, for coming together, because we couldn't come together during COVID, but also is serving as a platform for research. For research with regards to healthcare workers and their exposures and what happens thereafter, etc.
Yes. And in your endeavors, around this memorial, has there been any partnerships with the provincial or national health department, as partners?
I hope that as we move along, because the memorial has has gone viral now, especially with 702 Walk for Heroes. I think we're going to talk about that.
That's the real reason why you are here today.
Exactly. Okay. You see, which has gone ablaze at the moment. And I'll tell you why it has gone ablaze. We envisage partnership with the government, especially Department of Health, which is, naturally an important partner. And obviously at the moment we have reached out And we hope that in the coming weeks, we should find each other better. But the most important with partnership is the World Health Organization, the country office. They have collaborated to work with us and in terms of the database. Because we've got a lot of South Africans there, but we have got Dr. Usebe from Swaziland. We've got some doctors from Nigeria, and those were individual submissions from families. We couldn't refuse. And that is why the memorial is Pan-African. Now, there is no better partner to partner in terms of not just the database, but in terms of going forward to look at the future of the safety of care workers, the training. Because remember, Fundi, the second pandemic is coming. We must be ready. This pandemic, we were not ready. It's a fact. It caught us off guard. Okay? So, the World Health Organization, Old Mutual, which is, as you know, is funding healthcare workers, each healthcare worker who pass on, I think about 10,000 that they give for every healthcare worker who pass on. So we are also helping families who didn't know about it to access that, so that they can, do support or do something with the money. It's Old Mutual, and of interest is Department of Forestry and Fishery. They reached out to us because in our vision, we don't only, obviously, digital memorial, this memorial, it is in line with COVID. We had no choice. We had to do it, innovate around it. And it's serving the purpose because everybody can reach it. Everyone can reach it. But we envisage that to capture it even better, we want to establish a memorial monument embedded in a memorial park or garden. That will not only be a garden that is standing there, it will also be a museum to talk about the issues of safety and the history and all, so that the students and the scholars and the learners will come as a rallying point to find out exactly, what we're talking about when we talk about occupational health diseases, occupational risk, and indeed the work and the sacrifice that healthcare workers endure every day despite the challenges of mental health challenges, burnout, etc. So we want to also, to be an advocacy to that, because people mustn't think that, it's Fundi's Maggie there, we are okay here. We are in the front line and the war is not over.
Yes. Now, so Doc, thank you for, clarifying and helping us to understand, these healthcare workers, Heroes Memorial. Now, let's focus on the partnership that, you have made with 702, which is one of the biggest radio stations in Gauteng, which also is available, obviously, via internet anywhere else in the world. And I happen to be a resident doctor there. Every Saturday morning, I do a health feature. So it's one of the stations that is close to my heart. So can you just tell us then about what are you doing with them? I know that they normally have the 702 Walk the Talk that normally takes place around the second half of July, but it did not take place this year because of the COVID pandemic. But they have come up with something innovative, and I just want you to then tell us a little bit more about that, but more specifically, the initiative around the memorial, walking for a cause.
Yes. We are immediately after the 702 announced the virtual. In our program, we've got campaigns to ensure that we make the community and the citizens of the country aware of the memorial and what are the objectives and intentions, and obviously to honor all our healthcare workers who are gone, and an awareness program for all the, the occupational health risk and the people and the dependents that are left behind. Now,
Yes.
immediately we decided to reach out to 702, and we decided in our team that we have to work to honor
Yes.
our healthcare heroes.
Yes.
It is one of the highest honor that we can bestow, to walk in honor of a particular person. And we know that there are hundreds of families, there are hundreds of healthcare workers, and we sort of, rally around capitalizing on that.
Yes.
And we are walking. This is not just a walk.
Yes.
It is a walk of honor. It is a walk to uphold the legacy. It is a walk to highlight the plight of many destitute children who have been left behind.
Mm.
Some of the families who have reached out, we were not aware. Fundi, you'll think that it is nurses and it is doctors, they are okay.
Mm.
Some of the families, things are not okay, especially those that have left, dependents.
Yes.
And they have left them with a granny. They have reached out, and it opened our eyes, because we took it for granted that it's fine, everything, policies will pay, etc. It is not like that.
Yes.
So we are working, walk for heroes. That's the hashtag, walk for heroes. And when people register, they register to work for a cause. It's registering under healthcare heroes. And immediately we went on 702 on last week.
Yes.
The project went ablaze in social media.
Yes.
In this fashion, we had families wanted to work for recourse for this healthcare worker. We had healthcare workers. We've got, for instance, from Eastern Cape, one of our active branches, Moasa.
Yes.
They have taken all the people who lost their lives in the Eastern Cape, the healthcare workers, and I'm talking about paramedics and all.
Yes.
They have put them in one basket, and they are going to work for that, for work in honor of those healthcare workers. We've got the Mpumalanga group, which is very active.
Yes.
They also have done the same. And what is nice, it is not just doctors.
Yes.
We've got paramedics, we've got, the people who are serving food in the kitchen. It is very heartwarming.
Yes.
So, and this work as well, because we realize that this memorial is not just a digital, decoration there, that you saw the memorial is rolling out, and it's very heartwarming.
Yes.
Behind a name, there is a family. Behind the name on the roll of honor, there is a legacy. There are quite a number of things that can be said behind that name. So the memorial is just a name, but very important. With all the partners that I haven't mentioned here,
yes,
we are also, looking at, doing it as not just a memorial project, but with objectives of support, psychotherapy, psychological counseling. We have already started that. If you listen the clip on 702,
yes,
you'll hear the story of Nomsa.
yes,
Yes, which touched a lot of people. And, she mentioned that it's not her story only.
yes,
It is the story of many of the families.
yes,
So support, scholarships, sponsorships, PPE assist. There are people who reached out from a clinic, I think it's at Keiskama.
yes.
They reached out and said that, can the memorial help us with PPE?
Yeah.
Not to say, we have to be very clear. It's not to say that the government is not providing, but they get finished.
Yes.
When they get finished and it's taking time for government to deliver, we think that as healthcare workers, we should spring into action and have those resources to discharge those PPE to that particular clinic, to work together with government. That is why we are looking at creating a dashboard of where is lacking where, because we didn't have it during the first pandemic.
Yes.
Yes.
Now, Doc, so just take us through again, just as quickly. So there is the 702 walk the talk, and one goes through www.702.co.za, right?
Correct.
So once you are in there, then one will be able to see something that directs one to the 702 walk the talk. Can you just take us through just the practicalities of how to get there? Yes.
We have actually simplified it, even beyond the 702.
Okay.
With the families, we have sent it an infographics of how to register with a live link, and it is on WhatsApp. On that WhatsApp live link, if you look at it, I'll send it now. You'll see it goes to WhatsApp. It's a live link. You click to register, and it takes you to the 702 website, and immediately say register. You register name, surname, the course you are working for, and most people have registered healthcare workers. That it came fast and fury in the past 2-3 days. Healthcare workers, and then after that it's 60 rand. Obviously, it's for a course. You process the payment, 60 rand. The payment is processed online, and immediately after that, what a pleasure! Wow, you get that marathon. That marathon.
The number.
The number. You get the number. You get the number, and after you get a number, it's like now you are real now. You are ready to walk. So, and many people immediately after they get that number, they have obviously 702 has got it, but what people have done, they have sent it to us to show that they have registered. And what we have done, we have done a template of provinces to show where people are working. So that template, we are sharing it widely in the social media platform, so that people, you can walk in the comfort of your home, but quite a number of people have said they want to walk as a group. We are working in Dainfen, and we will be about, let's say, 30 or 40 of us.
But the security at Dainfen is very, very tight. How are we going to be allowed in that Lani place, Doctor?
We send the access code. We send the access to Fundi. The technology is advanced. Remember, I'm a health technopreneur.
Yes, I know.
So, yeah, technopreneur. We send the access code for everybody, and we will be working. Why? Because we have got delegated zones. We've got 3, 5, and 10. So at least we know those zones are, they are marked and they are visible, and it's a beautiful walk around the banks of the river. So we'll be walking, and many of the people are around 4 ways. And it's a specialist. We've got Dr. Mushiana will be working, who's popular here in this show.
The specialist dermatologist, my favorite dermatologist in Johannesburg.
Yes, very energetic, very energetic. We'll be having some of the specialists, in particular, the ophthalmologists. We'll be having some of the pain management specialists. We'll be having, some of the plastic surgeons. And our walk, before we start, we will have a special message from our alma mater. Dr. Judith Lameni, who was supposed to be participating in the walk, was blessed with a grandchild yesterday, so she will be busy with that. So she couldn't walk, physically, but she will be issuing a message of support. So we will start with that, and with that recording, her recording, we will immediately proceed, a moment of silence. And we urge everybody who's starting the walk to proclaim a minute of silence.
Yes.
People will be videoed, and they will take pictures, and they will begin the walk.
Yes.
And what we have done, Fundi, send Fundi that thing. We have done posters, and we are doing posters now.
Yeah. Yes.
People's families requested that they don't just walk.
Yeah.
They walk with a poster of a healthcare worker. We'll give you an example of one.
Yes.
So we are doing posters for them. We are doing it from our office. I've got a project team that since last week, it has been so busy with this registrations, and doctors and healthcare workers and paramedics are registering for a course. And when they saw that, you know, some of the people requested to walk with a poster of the healthcare worker, or a group of them, like in Eastern Cape, of the Border Healthcare Forum, then people requested such. So we are doing it for families. We are doing it for families and some of the doctors, so that they can just print and do those posters. So people are printing posters there.
Beautiful.
So it's a simple, we have simplified the process, and anyone who need that process, we send it quick and fast.
Yes.
And so, the poster,
Yeah. I was going to ask, for people like me who stay in the northern suburbs, obviously, Denven, it's an interesting proposition. But for other people who stay far, you know, from that, so what can they do to organize themselves, let's say in Soweto or in Alex or other places where it may be quite far to come to Denven? What is expected for them?
For instance, let me tell you let's say the family, like for instance, there are it's 200 policemen who wants to walk for the cause in Atteridgeville. We've got Mbulekwa Stadium, where you are familiar because you are a son-in-law of Atteridgeville, familiar with every corner, okay?
Yeah.
So, you know, Mbulekwa Stadium is so beautiful.
Yeah.
The Mbulekwa Stadium is safe. Some of the people, like for instance, we've got people who are working at Mbulekwa Stadium. Yes. Some of my sisters will be working there with a group of their gym, colleagues. Yes. So what we are doing now, we are populating all these venues. Yes. Like at Mpumalanga, the doctors and the sisters and the paramedics will be working from 2 stadiums, from Mbombela Stadium. So it's populated there, and we're going to we update it and send people all the time. Yes. So we hope by tomorrow we'll be having a lot of venues where people will be walking. Yes, yes. And not only that, you can walk around the comfort of your vicinity. Yeah. And take pictures and send us. And what is important, we are not working with we are working with the healthcare workers in our scrap. You see, I'm wearing a scrap, and we have sent stickers. Yes. It is written Healthcare Workers Memorial. Yeah. But those that don't have, they can get stickers or print or just a simple scrap. And the community, they are going to wear blue or white t-shirts. Yeah. So that picture, all those pictures we're going to put together. Yeah. As if we are walking from that venue at, what is that venue that we used to walk? Yeah. So it's going to
Max Park in I think it's Max Park in the next to Joburg. Yeah.
Yes. You see, it's going to create an effect as if we are walking there, as if it's business as usual. But those what we plan to do with the Healthcare Workers Memorial, we're going to congregate them and put that effect. And it is our wish, Fundi. Yeah. Our target is 1,000 at least 100 for each province.
Yeah.
At least 100 for each province working for healthcare heroes.
Yes.
So, and I think it's a target that is achievable.
It is.
Looking at the numbers that are coming now as we speak,
Yeah.
I think we can reach that target.
Well,
1,000.
we still have at least 3 more days before we get there. So
Yes.
I think those people who are watching, this conversation should actually go and register. I certainly am going to do that. I saw Dr. Mushiana was the first person to register.
Exactly.
And I am definitely going to also try and get a few of the people I work with here to also join, the Dane Friend Walk.
Thank you very much, and we will appreciate that. And we've got Matafeni Stadium, Eastern Cape. We will keep you posted with the venues, and we should not forget the cause.
Yes.
This walk is a call for action.
Yes.
It is not just a walk, Fundi. It's a call for action. You know that if we look in our history books, one of the first doctors who alerted the world about the COVID-19,
Yes.
Dr. Li Wenliang,
Yeah.
who
Yes.
succumbed of the virus.
In China.
In China.
Yes.
So Dr. Li Wenliang is one of the global patron of the Healthcare Workers Memorial, global, and it was a request. And the second one, Dr. Ame Adiwario, it is the doctor who saved Nigeria from getting Ebola.
Hey.
She was an internal physician. She stopped a person who has traveled from Europe, who came to Nigeria with Ebola. And she stopped that man leaving the hospital until the results were out and they confirmed Ebola, and she succumbed. So you can see the enormity of this occupational health risk. And those are martyrs. Those are our heroes. They cannot be forgotten. I'm sure everybody now has forgotten Dr. Li Wenliang.
Yes.
It's the
one
first
one. The one who was arrested and told not to spread lies.
Exactly. So that history, it cannot be archived. The healthcare workers must know that in the front line, sometimes it can be hard. And what happened? It was in Wuhan. Then COVID engulfed the world. And today, when Liang is no more, is nowhere. It's just a one doctor somewhere in China. But we are saying on the memorial, he will be our global patron, together with Dr. Andrew Murray, John Murray. Dr. John Murray was one of the doctors from Lung Union who discovered that COVID is causing an atypical pneumonia that is killing people. So, ironically, all these doctors, they succumbed to whatever they have discovered. Dr. John Murray succumbed last year to COVID-19 in the US. Yes.
That's quite sad. So basically, the call on this show is for everybody, whether you are a healthcare worker or not, to actually, it's actually, anyway, there's a benefit to walking. We've got so many illnesses that are as a result of low physical activity. So you can only gain by actually participating on this walk. Whether, obviously, we would like for people to walk for a cause, and you have already defined what that cause is. But anybody who is watching this, they should actually, at the end of this show, try and go into the website and register so that we can reach the numbers that you are targeting?
Actually, Fundi, if you think about it, some of our friends in the Philippines have registered. Some of our friends in the UK have registered. What a pleasure. With the, COVID-19, we hate to love it because it has opened our eyes to some of the new opportunities of doing things.
Yes, yes.
You see, I mean, look at your show. You are educating so many, people, and they don't have to come to your offices in Midrand. As it is now, my friend is in the Philippines, etc. They watch your show. They follow it on Facebook or whatever. And even with this work, I'm so excited. And as we sit here with the team, the ambassadors, because we are communicating every minute, every hour. As we Dr. Mshiani will travel, I'm sure. Yeah. Okay. What travel, I'm sure. Kirauri was working in Dainfen, now he's working, he's traveling that side to clear water that side. Yeah. So as we, as we walk, we must remember it's a walk that is calling for action. It's a walk that we have to honor our colleagues. It's a walk of upholding their legacy. And I'm saying, in terms of partnership, we are calling on government to come and partner with us, or we partner with them because they are bigger than us. You see, we partner with them and capture this because it might not have been in their mind because government is doing so much, if you think about it. So some of us who have got passion, we have done it before. Yeah. You remember Thokoza Memorial?
It's not the first time you are, setting up a memorial. As the community doctor at Thokoza during those dark days in the run-up to 1994, you used to dodge bullets there in Kumalo Street. Yes. And guys from the nearby hostels used to give you guys a hard time. And you decided, so what are the parallels when you think about what you did in Thokoza with the memorial there and what you are doing now with the Healthcare Worker Heroes Memorial?
Well, the parallel is that we are capturing the historical record of our history, number one. Two, we are having impact on families as a monument, memorial, as a rallying point for healing, for coming together, for sharing our grief, and also to support each other so that we can uplift each other. Now, in terms like this, where we couldn't meet, Fundi, to have a funeral, so the COVID-19, we have to do it digitally. We have to innovate. So the parallels are what I have said. And indeed, gauging on the response of the families and the community, it is doing exactly that, so much that those family submissions are being captured in a book, the testimonials of, how people were submitting and what they were saying. That is another historical record. And then, what is the difference is that with Thokoza Peace Memorial, I had to sit in between Congolos and IFP. IFP. And I had to sit, and you know that I'm fearless. I said, after I have seen so much blood that was flowing in our consulting rooms, because Fundi, the ambulance were not getting into Kumalo Street, we're not getting into Thokoza. After seeing so much blood, and the blood could not differentiate whether it was Congolese or IFP or ANC, Zulu or Xhosa, it got so many labels. Before I left the area, because I wanted to further my studies, before I left the area and then I decided to do a peace memorial, I had to sit and negotiate. Anything could have happened. You know, what if somebody decided, or I've got a double agenda, I'm an ANC member.
Yeah.
And
Of which you are.
Yes, I am. And then the, you know, the other guy will be on me.
Yeah.
But I decided to wear a hat of a medical doctor,
Yeah.
community doctor, the people's doctor,
Yeah.
who is going to bring peace to the warring factions.
Yeah.
And I was a better person to do it because I was providing healthcare for both, for both parties.
Yeah.
So
Anyway, the oath that you took,
yes,
you know, forces you not to see political affiliation. You save the
exactly.
life that's in front of you. And
Do no harm.
exactly.
Doctors are trained not to harm.
Yes.
Are trained, you know, we in our oath, they do no harm. It rings the bell to all of us. So I did it successfully. And ultimately, that's why I'm saying that government, we have to collaborate. Ultimately, it attracted our very famous, brilliant president, Thabo Mbeki, who said this project has got a potential of healing the community. And I remember when he signed that he is coming to Togoza. That was one of my greatest moments in life, because if you do a project that is acknowledged at higher office like the president, and he decided to come with the Chief Bustelezi and an entourage of political, you know, persona from different parties. And the media was there, CNN, you know, Kumalo Street was a no-go area. And I was in the center of that, founding that memorial. So in parallel, in summary, that was difficult. If you do an actual physical memorial, you have to negotiate, you have to sit with parties. But this one, everything was done digitally.
Yeah.
And I did it quick and fast. We did it quick and fast. We had Zoom meetings. We had to strategize with the medical women. And then I contacted Sama. I contacted, you know.
And you had your daughter too now to also help you, Umalebo.
Yes. And I had my daughter and the other doctors and the team within the Mediwell, which we are sponsoring the monument, you know, the project and the, you know, all the website development and stuff. Because sometimes, Fundi, we have to start. You can't wait for handouts. So, and that is even, it's less expensive than the actual physical memorial, you see? And we have to liaise with the government, because in Togoza, we wanted a memorial garden. The municipality had to give land. But I can tell you, Fundi, people like physical still. In Pumalanga, they said the community want physical monument. In quite a number of places, they said they like this one because they can access it. Now, that is why Department of Forestry and Fishery is important, and they have come to the party. I thank them so much.
You see, you mentioning the issue of physical, something that people can touch. It's one of the reasons why some people are still finding it difficult to embrace, what do they call this thing now? This form of burial.
COVID burials. What?
No. Where the body is taken and it's burnt. There's an English word for that. Cremation. Yes, you see now. You see, sometimes I think in Xhosa, so English takes time. But anyway, so you know, a lot of Darkies have not really embraced a cremation, because to them, they are used to being able to go to a place where they can actually say the body is lying here, you know, or something physical, you know. And we're running short of land in Johannesburg. So we need to start looking at doing things differently. And so, you know, digital memorials, or cremation, where you keep ashes in some place in Fourways Memorial and things like that, must be the new norm, you know. But obviously, in the context of our discussion today, it's really about virtual memorials, but also catering for those who want something physical. And I'm sure in time, you'll be able to accommodate them as well.
Yeah, indeed. Because, and what is nice about our vision is that, you know, in the past, we have this Togoza Peace Memorial, which is centered at the heart of Kumalo Street. Who goes there? In the country, if one wants to know what happened pre-election. But with this healthcare workers memorial, you see, as I speak now, because we have uploaded a new video, I've sent you the video, né? You'll see that video. We have uploaded it some few hours ago. So with that, you are it's now in the hands of most of the families who have made the name submissions, in the hands of all the managers from Netcare, Life, etc., who submitted the name right as far as Richards Bay, because they wanted to see their, their staff. It's in the hands of different doctors, different institutions that are collaborating with us, and the churches. We didn't mention other people who have come into the party. The churches, the South African Council of Churches, they have reached out to us as well. As they want to organize a national day of prayer, something like that. They want the healthcare memorial to be part of that. So it is getting traction. On when is it? On Friday, I think it's the Westphal Chamber of Commerce. They are honoring the healthcare workers in the Northwest. Beautiful. So yes, Nomsa is from Northwest. So she will be talking there. I mean, she will be talking through Zoom.
There's a point that you made earlier, Doc, about contributing towards healing. Now, one of the challenges of people losing their lives during the COVID period, especially if they died of COVID, was the fact that most of them, they died alone, away from their families. Even friends and loved ones did not always have the opportunity to say their goodbyes. And some of them were, stuck in Canada, that is family members or relatives. So when you have a virtual memorial like this, it actually helps those people who, because of geographical distances, are not able to be at the place where their loved one or friend or colleague was buried. So I'm just trying to say, and that goes a long way towards helping people, most the grief process, the death and dying, process, for that people can get to a point of acceptance, and also actually, look positively to the legacy of their loved one who has departed.
Yeah, and I can tell you now, like our young Nomsa story is known all over now. She's working with us now as a young ambassador for families, and they are reaching out. She can relate with them, in terms of talking to them about counseling, about, the sharing the pain, and Fatima Bucks out there. She's also the wife of this GP who died in Velcom. She is offering, she's a counselor. She's now offering some of the family counseling, and now we want to create that, that platform of counseling. If there is a family in Keiskamma, we should be able to find a counselor or social psychologist or social worker there who can go and, be with the family and stuff. And the important thing that I'm going to send you as well, we have come up with legacy heroes candles of hope and light. If you were looking at the funeral of Dr. Wonga, our ambassador, Dr. Bulelwa,
in East London.
Had a candle.
Yes.
That candle is, embedded with the picture. It was embedded with the picture of Professor Wonga and the Healthcare Heroes Memorial logo and, legacy to live on. Is a big candle. That is the candle that we light on the funerals, and the professionals or the healthcare workers, they come and surround and light it and give it to the family to show that our hero was a light, a shining light to us all, and he will remain a light to all of us, and his legacy will live on. And it was so heartwarming to see the children of Professor Wonga coming on stage with our ambassador and all the healthcare workers. They're coming to collect this candle that will remain in the houses forever. And every time when there is an anniversary, they will light it, or when they feel down, they will light, and it will be a shining light of, Professor Wonga and the others. We did one in Mpumalanga. So, Fundi, we are going to call for collaboration with stakeholders. There are Netcare people who died. They've got foundation. The hospital groups, there's, each one has got foundation. So it will be unthinkable to have those two children at Pulusong. I don't even know where it is, because there's a message that came that there are two children somewhere. The young doctor who was an intern died at Pulusong Hospital. He was an intern. Even our young doctors are exposed. But those stories will never be known. So you see, what the memorial is doing is a rallying point to make sure that we impact on humanity of, the dignity of our healthcare workers. It will be wrong for those two children who are being looked after by a granny. We are told by a neighbor, by the way, who are being looked after by the granny, and they said the granny is struggling because he's old. Let's send the social workers, the psychologists. They must assess the family, and if there is a need, because it's not probably many of them. If there's a need, with this fund, whatever we create, let us provide scholarship for those children. Let us monitor their progress and make sure that we are there at the time when they need us most. Why should we abandon some of the children of our soldiers? Fundi, there is a memorial, there's an event, big event, for all the security formations. The police, the soldiers, the correctional. I used to be a madam of a correctional officer, a correctional DG. I used to wear hats and go to Pretoria. There's a big place where it's a celebration, it's an event, and they support the children of this. So why can't we do it with healthcare workers? Just maybe you can give me an answer.
No, well, it's because, I'll talk more around the medics. As medics, we tend to, live in a way that, we're too competitive. We don't really support each other. So, the GP there, and the GP there, and the GP there, and the GP there, and you find that collaboration is usually a challenge. So what I'm trying to say is that what you have started will go a long way in breaking some of these barriers that were actually creating problems. When long after one of us is gone, you find that the family members are struggling, because whilst we were alive, we did not build bridges. We did not build bridges amongst each other. So those things have to disappear. But anyway, we need to wrap up now, Doc. What is there anything else that you still want to share in trying to urge people to participate this coming Sunday?
I would say to the citizens of this country, that let's go out in numbers and support this health care, walk for health heroes. Let's go in numbers. Let's register. It is seamless. You can walk wherever you are. It is not it's not a difficult process, and we will support in terms of the structures. Let's go in numbers and walk in honor of all the people who provide healthcare for us all. We should remember that we are working for soldiers who went to the front line with our visors and masks and gloves and PPE.
Yeah.
We went to the front line to fight a COVID war, to fight a war that has not been declared. And unfortunately, some of us didn't come back.
Yes.
And those that survived, like you and me, Fundi,
yeah.
let us ensure, and there's some of the citizens of this country, that the very same healthcare worker breathed for them at the time when they could not breathe.
Yes.
Come in numbers and support this walk in big numbers. It's not only for healthcare workers.
Yes.
It's for families and it's for the citizens of this country.
Yes.
And for all the doctors, let our patients register in numbers.
Yes.
Because they should remember that some of us could have been statistics.
Yes.
So we are not stats. We are heroes. Our colleagues are not stats. Behind the name, there is a family.
I just saw a face there. Who's that face? Just on your left.
Oh, it's Nomsa. It's one of the family. It's Nomsa.
It's the lady who is the contact point for families.
Is the lady who's the contact fella for families.
Let's see her properly. Let's see her properly. Let's make her famous.
Yeah, this is representing families in earnest.
Yes.
Yes.
All right. No, well done, Nomsa.
Yeah,
well
that is Nomsa. Yeah.
Hello.
Ralebu.
Yeah.
All right.
Okay.
All right. Yes. Can I see you, Dr. Meg Stella? Yeah.
Yeah.
All right. So, Doc, no, thank you very much for continuing to do good out there. I mean, when I got to med school, you were active. Those days, it was a big fight against apartheid and the brutality of the police, 1984, 1985, and you were in the forefront. So this thing is part of your, of your genes somehow. You just keep on reinventing yourself. You were in the thick of things, in the cattle race wars as the community doctor. Now it's a different war. It's a pandemic, and you are involved as well. So just keep on doing the good work. I can see Ausfina there, your twin. Hi, Ausfina.
Good evening, Doctor. I've done a lot of posts about the coming walk.
Yes.
You'll see them. I've made a lot of comments,
Yes, no, lovely. The more the merrier. We need more people to participate. Is there a possibility for people who can't, for whatever reason, participate, but because those 60 rands will add up to something? Can people who may not be able to walk but register and pay the 60 rands? Don't you think that can also help to swell the coffers?
Yes, Fundi, we have done that process, and it's the process that we are sharing on the media, because we are not, the memorial is going to outlive the walk.
Yes.
So, and as you see, we have got a lot of work to do in terms of research. We still need to do a documentary that is going to educate the public in terms of the healthcare worker safety. There cannot be patient safety without healthcare worker safety. Yes. And because we are going to work with the World Health Organization, we are going to take the step forward. What the memorial is saying is that we should ready ourselves in terms of the pandemics that will befall us. We should be on the ready because we know that the second wave might be with us soon.
Yes.
So when the second COVID waves come, we don't want to find ourselves in lack. So we need those funds. People who wants to pledge, it will be in our social platforms, because it is for the cause.
Yes.
It is for the cause. And Fundi, I think for the last time, not last time, but we shall never, the Healthcare Workers Memorial is saying, we shall never have a clinic deep in the rural village, or a clinic in deep slot, or even the GPs.
Yes.
You see, people, we sort of tend to separate the public and private.
Yes.
COVID didn't choose whether you're in public or private.
Yeah.
So one of the lessons the Healthcare Memorial will highlight is to say that universal healthcare is the way to go. When we had 5 patients, 3 private and 2 public, and we couldn't take them to the local hospitals, 5 hospitals, Sunning Hill, Life, etc., they were diverting at the height of the pandemic. When we couldn't take the patients to those hospitals, some of them with medical aid, when I phoned Dr. Licia or some doctor, superintendent at Barra, to ask her what can we do, she was packed. And then, but where did we take those patients? The ambulance took them to Barra. And then now you see our system is flawed. So come in numbers, let us work. There's a lot of work that still needs to be done. All those that needs to pledge beyond, look at our platform, info at Healthcare Workers Memorial, and we promise that we should never be in lack, and we should be all trained. We were not trained when the COVID started. Nobody trained us about this. The government tried, but it was too much for them in one plate. So ask not what the country can do for you, but what we can do for the country. Let's collaborate. I hope the Department of Health is listening to us so that we can collaborate much even better, because we haven't found each other with the Healthcare Workers Memorial. And it is my wish that we should.
Okay. Thank you very much, Dr. Max. Your energy is infectious, but keep on doing all the good work. And I'm sure when you were growing up as a fellow twin to Ausfina there, you must have taken all her energy.
Yes. He has said that, you remember. No, I still have got energy, Fundi. And it is my wish that one should pass the baton to our young doctors, our young healthcare workers, to show that collaboration is the way. As you say, doctors like to work in silos. And COVID and this memorial, it has taught us that it is not something that is sustainable.
It's not.
It's not something that is sustainable. We have to collaborate. And with this memorial, through collaboration, I could talk from a funeral to a funeral in Mpumalanga. And I could just record and talk and participate in the funeral because they wanted something about the Healthcare Workers Memorial. I participated in many of the funerals. And it was through this collaboration, the ambassadors were there. It was a team effort. And I hope with this Healthcare Workers Memorial, after we have been hit so much, we can only rise up to the occasion of collaboration.
No, thank you very much, Doc. I know we only agreed this morning to have this discussion, but it was important so that people can still be able to go out there and register long before Sunday, which is the actual day. So what time is the walk in Dainfen on Sunday?
There's the walk in Dainfen. It will start at 7. It was, I walk at 5 normally, but many people can't do that. So we said to accommodate people, we should start at 7, because once it's sunny, it will be tedious for some of the people like Mushiana who will be doing 10 kilometers with us. We've got 3 and 5 and 10.
All right. Now, I will see you on Sunday morning.
Fantastic. Thank you very much, Fundi.
Thank you. Ausfina, will she be participating as well?
Yes, I'm doing 3 kilometers.
Why 3, Mara?
I will be also taking pictures for the walk.
Okay. No, thank you very much. I'll see you guys on Sunday then.
You can see who's athletic, Fundi.
Yes, no, Ramon.
Some people
but she's also doing great work in her foundation. I saw her with the big people there doing some great work in her foundation. So,
yes,
you guys are just blessings to humanity, and continue doing that.
Thank you, Fundi. Thank you for your channel. It's now CNN. It's a healthcare CNN in South Africa.
All right. Thank you very much. Thank you to all the viewers who managed to listen to us. We appreciate your time. And those who are able to register, please, let's go register in numbers and make sure that we exceed the 1,000 number that is targeted by Dr. Max. Thank you, and goodbye to everybody.